These misconceptions that guys have, I think they come, social media is obviously a big part of that. Social media is it's a double-edged sword, obviously. I was just chuckling last night. I was just trolling through one of the forums before I went to bed, and there was at least two posts in there about guys that all of them had been on TRT less than 4 weeks, and they were complaining that they weren't getting, I don't feel any different. What should I do? And like, thankfully most people on there were like, listen, buddy, you got to give this 4 weeks is not enough time to make a protocol change. But they were already looking.
Sure.
And I blame obviously social media and
Right.
things like that are partially responsible for that. But also it's their clinician. They really, it's obvious that somebody, their doctor, prescribing provider, whoever the case is, didn't sit down with them and do some expectation management with them before prescribing to them. And that's really key to kind of set the stage for expectations. Many guys come in with erectile dysfunction,
Mhm.
and they're under the mistaken belief that the only reason I have ED is because I have low testosterone. And so a week later, after my first shot, when my levels are normal, I should no longer have ED. Well,
Correct.
the data is very clear on that sustained improvements in erectile function can take months. It can take months.
52 weeks, 52 weeks, up to 52
Yeah,
weeks.
exactly. And if you have atherosclerosis in your pudendal and penile arteries, I'm sorry, but now we have a mechanical flow issue that we need to address. That testosterone will only partially address that. So that's really important. You and I both spend a lot of time, I think, managing expectations in guys because many times they're unrealistic.